Thank you so much, everyone, for selecting to attend our session on being a data detective. We are so excited that you are here and thrilled that you have joined us to learn more about the All of Us Research Program Data Browser through an interactive exercise. I'm Dr. Elizabeth Cohen, the Principal Investigator of Ignite and the Co-Chair of the Science Committee of the All of Us Research Program. Ignite conducts workshops nationwide to help participants, communities, and community-based organizations use their own local data to improve health. We appreciate the chance to conduct this session, and we want to recognize the efforts of the program staff, including Drs. Denny, Ginsberg, Shelley, and Sydney McMaster, and the program staff who are staffing our chat and Q&A, Fletcher, Jessica Lee, Katrina Tice, and Jessica Bonella. Shortly, I'll introduce Nikisa Porquet, our Program Director for Ignite. First, some additional housekeeping. Again, we want to welcome you to be a data detective and explore health data like a scientist. In this guided hands-on activity, we'll be using the data browser live, and we'll encourage you to do so as well. Science Day is a public event. To protect your privacy, you can change your display name before entering a session. Closed captioning is available throughout the day. To turn on closed captions, please click the CC icon at the top right of your screen and choose your preferred language. If you run into any technical difficulties or you need an accommodation, please email allafusscienceday@pixispartners.co, and we'll put that in the chat for you. To get us started, we want to create an open, respectful, and engaging space for everyone. To ask a question, please select the Q&A option at the top right of your screen. Type your question and submit it. The Q&A is private and monitored by all of us staff. Questions submitted through the chat box will not be monitored. The chat box is public, so please be mindful of any personal information that you share there. For this program, for our work, your privacy matters. No personal data will be shown. We're going to show group level summaries only. And while the data stays private, altogether it helps advance health research for everyone. With that, I'd like to introduce the Program Director for Ignite, Nikisa Porquet, who will take us deeper into the data browser and answer some questions that have been posed in advance and some questions that you have today. So I'm introduce my colleague and friend, Nikisa Porquet.
Hi, everyone. Hopefully everyone can see and hear me. Thank you so much, Dr. Cohen, for that introduction. As she mentioned, my name is Nikisa Porquet, and I'm the director for a program called Ignite, which Dr. Cohen mentioned. We're at the City University of New York. And as she mentioned, Ignite partners with communities to strengthen connection to the NIH All of Us Research Program. But we do this through things like convenings, health events, educational programs, and we really want to ensure that participant and community voices shape research and that knowledge is shared back in meaningful ways. So our work helps to build transparency and lasting collaboration between communities, researchers, and participants. So as Dr. Cohen mentioned today, we're going to be doing a hands-on activity. And by the end of the session, we're hoping that you can understand what kinds of health data are publicly available, how you can use it, how to navigate this tool called the data browser that we're going to talk about, looking at patterns, contributions to research health, and feel more confident about engaging with research as a community member, a participant, a curious participant, or a curious mind, and understand that research doesn't have to be intimidating. So we're going to also explore some projects and research questions. So today's session, I'm going to show you not how to look at the data, but also what's being done with it. So while you're going to be asked to complete some polls, I just want you to know you're not being tested. There's no right or wrong answers. You're just exploring. And we're first going to talk about what the data browser actually is. So it's a public online tool accessible to anyone. You don't need to register or log in. It gives a big picture of the view of types of data available and some of the basic statistics without ever showing any of your personal details. Of course, it's important to note that All of Us is dedicated to keeping your data safe and private. So everything we see today is going to just look at counts, averages, or percentages. So with this research tool, you can find out how many participants, for example, have a certain condition, see their responses to surveys, look at physical measurements, even wearable data like Fitbit and genomics. And all of this data has been carefully organized to make it easier for you to explore. So today, you're not just learning about research, you're going to actually do it. So let's take a more comprehensive look about what's in the data. So it's data from healthcare providers through things like electronic records, which include diagnoses and lab results. And that's if a participant shares to choose and share that with all of us. There's also participant surveys that include things like housing, income, access to care, lifestyle factors, and there's also wearable data like Fitbit, which I mentioned. And lastly, there's genetic data. In fact, All of Us is at this point one of the largest and most diverse genetic biobanks in the US. So I think that's very commendable. So as I mentioned, not just EHR is being shared, which is electronic health records, but participant surveys, which I think is one of the most valuable sources of data. So I pulled one of the surveys that we frequently refer to. It's my favorite one personally. It's the Social Factors of Health survey. It's got about 80 questions covering a range of topics like neighborhood safety, social support, stress, environment, food security. You can see here just how broad the questions are. And you can also see that there's close to 260,000 participants who've answered these. But that number is even higher. All of Us is continuously working to update this data in different data dumps. So hopefully we'll see updated numbers soon. So Data Browser is a starting point for researchers, students, curious minds, like I mentioned, and participants such as yourselves. We actually encourage at Ignite for researchers to do the data browser as a starting point. We do scavenger hunts, which I'll refer to later when we start to talk about the activity you're going to be doing today. But the most important thing is that it helps with publications. And while publications might not impact your care immediately, they are important. They're essential for improving health because researchers use this to develop new studies, share findings with their colleagues or other disciplines of care, and build on the science to further future intervention. So like I said, while you might not get a return of value today or even next year, it's helping future generations with interventions like medical devices or medications. So like I said, identifying patterns today helps future generations. So with that, we're going to dive into our interactive activity. So I'm going to ask you to respond to the poll on your screen. It should come to the right. The poll is going to be asking you our first look at what's called the data snapshot. And the poll is going to ask, as soon as it's opened, which state do you think has the most participants? So we've got Arizona, Texas, Pennsylvania, or Illinois. So go ahead and take a moment to answer that. Again, your best guess. We're going to take a couple more seconds for you to look that up. That poll up, and then we will talk about how to find it. All right. So it seems like there's actually a tie between Pennsylvania and Illinois. So that's actually very interesting. So next, we're going to find out how to find the answer to this question. So you can either follow along on my screen, or you can follow along on your own screen. You can scan the QR code here, or you can type in researchallofus.org, or lastly, you can click on the link that's going to be provided for you in the chat. But of course, like I said, I'm going to share my screen to give you an idea of what it looks like if you're not able to follow along at this time. So give me a moment to change my screen. All right, so hopefully everyone can see a view of the data browser. This is called the Research Hub. It's a very simple platform and interface. And the first thing we're going to do is we're going to find the answer to your question about the state which has the most participants. So that's actually housed under Data and Tools in the Data Snapshot section. And the Data Snapshots is a great place to get a first look at high-level numbers. So as you can see, we've got enrollment numbers, the number of participants who've consented versus giving their initial information. We've got the number of outreach funded partners and organizations. And like I said, this number is constantly increasing. So it's even higher than the data you're seeing here now. And we're going to look at the state which has the most participants. So some of you said Illinois, and some of you said Arizona. The answer is Arizona, but pretty close. Illinois was second on that list. As for the state with the most number of participants, that's going to be California. So you can get an idea and take a look at which state you're from. But what's cool is we even have participants in Alaska. And then when you scroll down, you can see the breakdown by age. And it looks like the majority of participants in the All of Us research program are aged between 60 to 69, but it follows this bell curve. So next, I'm going to ask you to complete the next survey. So this survey is going to ask you about your interest related to a specific health condition. So we're going to ask you which one you'd rather take a look at today. There's diabetes, dementia, hypertension, or anxiety. So I will give you a moment to answer that poll. And this answer is going to help inform us about the rest of our activity. And give it a couple more seconds. Get your answers in. All right. So it looks like the majority of you would like to learn a little bit more about dementia. So we are going to find out how to find that condition in the data browser. So right now we're in the snapshots, like I said, high level overview, but let's get to the exciting part, which is the data browser itself. And as you can see, we're back here to this interface. So you can see here, there's electronic health records. And under that is things like conditions, drug exposures, labs and measurements and procedures. We've got our genetics domains, measurements and wearables. So that includes things like Fitbit. And then at the very bottom, we have our surveys. So for this case, we're looking at conditions. Oh, it looks like someone accidentally unmuted themselves. So if you can just make sure that you are on mute, that would be great. All right, so continuing along, there's close to 28,000 medical concepts. So that's different conditions. That does include things like diabetes, anxiety. You can see just how many conditions there are reported. And we can also see how many participants reported or answered by providing their electronic health records. So you can see just how many participants we've got for that. So to find information about dementia, which is the poll winner, you can type in dementia here. And once you do that, it gives you a really cool breakdown of how many participants have dementia as a diagnosis. And the cool thing is that you can click on that and get a little bit more information. So about 2% of the population in the data browser has a diagnosis of dementia. And you can also see the breakdown by age and sex. So the majority who've been diagnosed are between 70 to 79. And we can see the breakdown by sex as well. So the majority are reported as being female. And lastly, you can take a look at the location as well. Here are the states with the highest numbers of dementia reported. And you can do this with any condition. Next, we'll go back to the data browser, and we are going to look for a survey now. So the next survey is going to be a question specifically related to two domains, healthcare access or food access. So take a moment to answer that one. It's going to inform our next set of discoveries and answers. Okay, so far it seems like the majority are interested in healthcare access. All right, so let's take a look at healthcare access. Now, as I mentioned, you can find the surveys closer to the bottom of this interface. And we've got all the surveys here. So the basics, overall health, lifestyle, healthcare access and utilization, personal and family history, and social factors of health. So now that we've gotten our topic of interest, we're going to ask you to answer a specific question that's actually asked of participants. So take a moment to answer this question related to healthcare access. Participants were directly asked how many answered yes. In the past 12 months, they've delayed getting care because they had to pay out of pocket for some or all of their procedure. So take a moment to let us know how many participants you think responded yes to this question. Okay, so it seems like the majority of you responded with 21%. So let's find out if you were right. So the first thing that we're going to do is we're going to go to the Healthcare Access and Utilization Survey, because that's where this question lives. So you can see here just how many questions participants are responding. And this specific question, we can either, as you can see, there's a lot of questions. So you can either scroll through them, or you can type in a keyword that you're interested in. So for example, you can see here a question in rural area health. So if that's something you're interested in. You can also see questions related to getting childcare, getting time off. But our question for today is, in the past 12 months, have you delayed getting care because you had to pay out of pocket for some or all of your procedure? So our question was specifically, how many participants responded yes? So for those of you who responded 16%, you are correct. And again, the cool thing you can do with this is toggle to see the breakdown. So the majority of participants who responded to this are 30 to 39 years old, and 75% of them are female. So this can give you an idea of the patterns, what's being captured. And this shows again how broad and meaningful these surveys are. Health isn't just a diagnosis code or a condition, it's your environment, it's your lifestyle, your lived experiences, and that's what all of us is capturing through these surveys. So please do take a moment to explore these surveys. We've only just uncovered the very tip of the iceberg with all of the data that's available. But again, you can see things like Fitbit with close to 60,000 participants having provided that. You can find physical measurements. And you can also see, like I mentioned before, how many participants have answered a survey and how many questions are available in that survey. So next, we're going to talk about the actual research itself. You should see a poll on your screen again. And in this poll, we're going to ask you, how many research projects do you think are currently underway? The answers are 10,000, 12,000, 18,000, or 25,000. So take a moment. I'll give it a couple more seconds for those of you who are still deciding. All right. So we'll close the survey now, but it seems like the majority of you think there's 12,000 research projects underway. So let's find out if you are correct. So while the data browser houses all of the data, if you scroll further to the top, under the Discovery tab is where you can find more about the research underway. So the research project directory is where we're interested in finding that number. And just as a note, the research project directory sometimes can take a moment to load just because of how much data there is in here. So if you get an error or refresh page, just give it a second or click load again. All right, so for those of you who answered 25,000 total projects, you are correct. That's a huge number, and the number is growing every day. So with these research projects, you can see the exact scientific question being asked. You can see the purpose behind it. You can even see the owners of the project and the researchers who are working on it. And again, that's to maintain transparency and for you to know exactly where your data is going and how it's being researched. So to follow through with our theme of dementia, you can also type in a keyword here and learn about how many projects are related to the condition that you're interested in. So in this case, there's over 500 total projects related to dementia. And like I said, you can see the team working on that, the exact research study, and what institution they're working out of. And the next thing we're going to show you is the publication directory. And that's where you can see the number of publications. So there's over 1,300 publications, but this number is not necessarily accurate. There's publications coming out every day, and this is uploaded once in a while. All of us does a great job of importing the data as much as possible, but it gives you an idea of just how much data there is being researched, published, and disseminated amongst researchers. So it's very encouraging. Again, while looking at a publication might not give you an idea of how that can affect you in your lifetime now, this is very important because it's establishing patterns of research that researchers use among themselves, that even community scientists or curious minds like you can look up and learn a little bit more about. So I hope you take the time to learn more about the data browser. Again, there's the data browser, the data snapshots, the Discover tab with the research projects directory, and the publication directory. And all of this is going to be shared with you in the chat. I'm going to stop.
What we'd like to do now.
Okay. Oh. Everyone can hopefully hear me. All right. So thank you again so much for participating with us. The resources you can use are here. The chat is going to enter these resources for you to continue looking at data that might be of interest to you. We would be delighted if you would take a moment and if you have been able to open the data browser on your end, take a moment, type in a condition in the data browser and look up a stat that might be of interest to you, put it in the chat. If you haven't been able to open the data browser on your own just yet, you can take a moment and enter in the chat a keyword that you are interested in learning more about in the future or that you would like to explore after today's session. So please take a moment to do that. We always love to hear about what topics are of interest to our participants. So feel free to enter that in. So for example, if you're interested in sleep disorders or hypertension, if that's something that you'd like to look at in the future, we see air quality impact on health, alopecia.
We can demo
And we're-
those, actually.
Yeah,
Maybe
we can
we'll do
actually
that.
demo.
Yeah.
We can certainly do that.
These are all great, so please keep them coming. What we'd like to do is just do a quick, this is fantastic because it also helps us understand what what your main interests are. So I think we will demo as many of them as we can. And we really want to hear from you in terms of the types of things that you're interested in seeing research through the program.
Okay, so hopefully everyone
While Nikisa is teeing up the data browser, I'll just say somebody has asked about adverse pregnancy outcomes, and I'm going to link you to an article that has that uses the All of Us research program for conditions that affect women differently, disproportionately, and uniquely. And one of our examples is postpartum hemorrhage. So I'm going to just put the article is free, of course, and available to everyone. And it talks about how this data can accelerate care. Go ahead, Nikisa, and I'll put the article in the chat. Sorry, you're muted.
Okay, hopefully everyone can hear me now. All right, so I'm seeing a lot in the chat. So the first thing I saw was alopecia. Thank you for those confirming that you can hear me. Okay, so as you can see, there's a breakdown by alopecia. The other thing that's really interesting is that it gives several types of alopecia diagnoses, so it can be very specific, but it does look like there is about 4.5% who've reported as having alopecia. And again, if this is of interest to you, you can look at the breakdown by age or sex and take a look at the location. Again, this could be very it's a moment to establish you as a community, the data that you've provided, but also if you haven't had a chance to sign up for All of Us yet, it can also be a great place if you are interested in conducting research of your own. So another condition I saw was leading chronic conditions like heart disease. So in the data browser, it does give you the top 10 conditions, but when you have 28,000 conditions overall, it is helpful to type in specifics. So you can see the top 10 conditions reported. Chronic pain is the top reported condition with close to 280,000. But if we're interested in looking at heart disease specifically, we can type that in. And as you can see, there's almost 120,000 participants with heart disease. And it does break down again, cardiac disorder. You can see what percentage of participants have it and the age of occurrence. If you have something that you're interested in beside a specific condition, for example, interested in learning more about neighborhood safety, that's also something that you can look up. So if you'd like to take a moment to enter a social factor of health, we can certainly do that as well. And that's going to be in the surveys. But the cool thing is that if you do a keyword search here, it searches in all domains. So let's say, for example, we wanted to look at housing. It'll show you exactly which survey that's kept in, which is the social factors of health. and it pulls the exact question: what is the main type of housing in your neighborhood? And again, you can see the breakdown. Detached single family housing is the most prominent. And again, you can see the breakdown by age, sex, and location. So it's a great place to start as a community scientist, a citizen scientist, or just a curious individual. I see a question about genomic data for those who do or do not have a condition. So the genomic data shows more of a variance, the different types of variants. So for example, if you are interested in BRCA, BRCA 1 and 2 is linked to breast cancer and other types of cancer. You can see here the gene BRCA. It'll show you how many variants are present. But while these are counts, you're not able to do what's called cross-tabulation. So for example, if you wanted to see in this data set how many people have BRCA and breast cancer, that unfortunately isn't available until you go to the next level tier of access. Again, all of us is committed to keeping your data very private. So researchers who want to look at those specific variables have to go through a very rigorous process of applying, entering in their information, and doing training to access those higher level tiers of information related to genetics. They're very, very careful about genetic information.
Nikki, so I'm going to take one of them while you reset, if that's okay. And somebody is asking about learning more about osteochondromyal causes, or really the causes of any condition. So I just want to say a word about how the data can and is best used. That's great. We can, what I was going to say is that this data set will be able to tell us how many cases are identified. To work backwards to learn the causes, or it's not a data set that can develop causes, but is more a data set that can explain associations, meaning that we can't definitely say from this data collection what caused it, but we can understand what conditions are associated with the development of conditions. That is going to require the assistance of a researcher to do some programming language. But those are the kind of questions that we are hoping people will ask, that can help us then develop research questions that can answer about specific causes. So just a little bit about how research is constructed on that one, and happy to talk more about it. This one was about osteochondrial causes. So, but this is for, yeah. Oh, thank you. And it's pretty small on the screen, but you can see that we'll be able to do counts for you, and we'll know how many people, but we won't be able to tell from this an actual cause. I just want to see what else is in the chat and what else.
So Lynn,
yeah, go ahead.
I see a question. Do we need to be associated with an academic institution to get the screening and training to connect genomic variants to specific diseases? So you do not need to be affiliated with an academic institution. There are organizations that are community-based, even some industry partners or nonprofit organizations. But there is what's called a data use agreement. We can certainly drop that in the chat. I'll find that for you. But there's a whole host of different types of institutions and affiliations that can get access. And if your institution or affiliation isn't listed, you can certainly request access. You do have to go through a bit of a process, but again, if you're interested in doing research, there might not ever be an opportunity for you to access this amount of data specifically as it relates to genomic variants. So it is very much beneficial to try and look into data use agreements.
We have a question about GI-related diseases, and we can work with that. That one is going to have a large funnel at the top because of all the conditions associated with GI. 67 matching conditions, yeah. So that those we would help in general people with interests like that. We would help them narrow it down to a more specific research question. I guess I'll give maybe some examples of ones that we have seen that have been very successful and doable. So there is an example that I absolutely love. A doctor in an institution did answered the question, does food insecurity, we have 2 questions on a survey about food insecurity. So their question was, does food insecurity and reporting being food insecure lead to readmissions for congestive heart failure in the hospital? And they looked at those 2 survey questions plus being readmitted for congestive heart failure, which is a common chronic cardiovascular disease. So those are the types, and there was a relationship between being food insecure, and that makes sense because the diet to control that is challenging at best. So that's a type of thing where we can start with a question like that, and then we can dig into it a little deeper, like what would help patients have better diets and avoid readmission, and that becomes a study on its own. Then that can become an intervention study or a study that proves causation or something where we can really affect care. So it's a 2-tiered, it's kind of an up and over the net type of an arrangement for research.
Absolutely. And while Dr. Cohen was mentioning that, I did a quick search for food, and you can see the 2 questions that are asked of participants specifically around food. But you can also see that there's conditions related to food as well. So you can see various electronic health record mentions that relate to food. And please feel free to put additional questions. These questions are also very helpful as we think about connecting with researchers related to your specific interests. And NIH Support has also entered the link for how to become a researcher. And that link will show you just how many institutions are registered to be users of the All of Us research program. It is very impressive just how many organizations are interested in using the data. I might be able to quickly show the kinds of institutions for those of you who are interested in taking it to the next level, going into what's called the researcher workbench. So you can see the whole list here.
While Nikisa is doing this, I'll just say, as you can see as she's scrolling, that there's an R and a C. And the R is for that the institution is a registered user, and C is a controlled tier. So we're viewing the public data browser right now because we're in the public domain. We never, ever show screenshots or publicly present anything other than the public data browser. But as you become more and more certified to use this program and authenticated as a researcher, you have greater and greater access to data. And so it's registered tier, controlled tier, and the public tier, which we can share broadly.
Yes, and as you can see, someone had mentioned you have to be affiliated with an academic institution. You can see here there are groups like the Asian Health Coalition or Asian Women for Health. So you do not need to be part of an academic institution. You can be a community-based organization as well. And we've actually worked with community-based organizations in Harlem, New York, to help get them access to this data set as well.
So I want to give us a time and process check. We have about 5 more minutes left in this session, and we'd love to hear from people or see comments from people who haven't asked a question or haven't had a chance to. We welcome those very much, and we want to use this time for you all to say if there's anything else that we missed or that you'd like to hear more about. We'd like to do that now as we close out this session. And as we transition you all to, there's a session that follows this. I think, Nikisa, we probably need to even go back to the slides.
Yes. Hopefully you can hear me. We want to thank you for joining us. As you can see, this does lead to real world impact. Understanding the patterns of health are very important for future innovation, discovery. I'm going to share my presentation again. That might cut off my audio, so just give me a moment. Okay. So if you'd like to ask a question live, you can do so. In the meantime, I do want to let everyone know that up next after this session, please join either session 7A, which is understanding heart health, diabetes, and other long-term conditions, or join 7B to learn how researchers are using data and technology to drive better health. And please be sure to complete the one question survey at the end of this session. I think our moderators are going to be able to put that in the chat for you. If you weren't able to, I actually went ahead and put it in for you, just in case you weren't able to capture exactly what the sessions are going to be about.
We have a few questions in the chat. We've saved the sort of the complex ones for last. I'm going to take Matt's question for a minute. As a patient, how do I encourage my doctors to use these tools and data? We're actually working on that as part of the return of value for the program. We hope that you'll use this data and the tools, and we do hope that eventually doctors will as well. And for I need to just take a minute to take a look at this. For rare diseases, at what granular level data will be available? It showed at less than 20 for I'm glad you asked. This question is about rare diseases where there's a count less than 20. Overall, for the program, universally, anytime there's a count less than 20, we don't report that individual data at all. And that is to protect patient privacy and as a safeguard against re-identification. So for now, until the count reaches above 20, there would not be a way to look at that data, and that's intentional so that we can help protect it. But we do work with rare disease networks, so we hope that this has tremendous potential to help in the rare disease space, because collecting people nationally with a rare disease is such a difficult task, and we really do hope this will be a platform for that. There's a special emphasis on rare disease. I think we're actually in Rare Disease Week right now, so we really have a special emphasis on rare diseases, and we want to support that. Please let us know how we can continue to support people doing research in or living with a rare disease. That is really has been forefront in our minds and in our programs for a long time. I do not know the answer to the paper publishing question, so I have to let the NIH help us with that one. And what's on your screen right now is the scientific sessions that will start in just a few minutes. I want to give people time to transition. I see the heart health and diabetes one that looks so amazing. And I think following up on this session, how researchers are using data and technology to drive better health also sounds like a fantastic session. So I invite you to contact us. I will again put our email in the chat. There's one question that I did want to answer, and I also want to thank our Q&A moderators and Nikisa Porquet for this excellent presentation. The question from the audience: how can I find the relationship between dementia, osteoporosis, and hormone levels in peri and postmenopausal women? The way that you can do that, it can be done, that type of thing, the relationship or at least the association can be found in this data. We've done some papers like that. You will need somebody who can code in R or Python. We provide some of that support, but we have a program that does that, but the person we have to have somebody on the team that's able to do some basic programming. But please email us, and I'll put our emails back in the chat. Please email us and we can provide more details there. Please help me in thanking the people who supported this and selected us for this program. We were beyond thrilled, and we are so glad that you chose to join us, and we hope that we hope to hear from you.
Yes, thank you again so much, everyone, for your participation, and we hope you take away some of the resources we provided with you to continue exploring your data.